Electroencephalography. EEG abnormalities include the following: epilepsy, interictal epileptiform activity consisting of spikes, sharp waves, or spike wave complexes is strongly but not absolutely correlated with epilepsy. Thus, the presence of spikes, sharp waves, or spike wave complexes does not unequivocally indicate a diagnosis of epilepsy, nor does their absence exclude it. Nevertheless, their presence in combination with clinical information frequently allows one to make a diagnosis in terms of recognized electroclinical syndromes. Ictal discharges or electrographic seizures provide irrefutable evidence of an epileptic seizure disorder. In generalized epilepsies, electrographic seizures may consist of a pronged run of otherwise typical interictal discharges, but in partial epilepsies, this is rarely the case, and the ictal patterns have their own morphologic features. The absence of an ictal EEG pattern during a typical generalized convulsion provides strong evidence of a non-epileptic seizure. But this is less true for auras, focal motor or sensory seizures, or complex partial seizures. Focal brain seizures. The presence of continuous focal polymorphic delta activity, especially in combination with depression of ipsilateral background rhythms, strongly suggests a focal lesion. However, an area of focal dysfunction, as may be seen after complicated migraine or a focal seizure, should also be considered. Periodic lateralized epileptiform discharges, PLEDs, are frequently associated with irritative lesions such as acute cerebral infarcts or herpes simplex encephalitis. Diffuse encephalopathies. The EEG has a high sensitivity for detecting globally disturbed cerebral function but is not nonspecific as to origin. Exceptions include Alzheimer's disease and HIV encephalopathy, in which the EEG may remain normal until late in the course of the disease. Early changes include slowing of the alpha rhythm and the appearance of generalized theta activity. More severe cases show generalized polymorphic delta activity. Frontal intermittent rhythmic delta activity, FIRDA, and lack of normal reactivity. Triphasic waves are seen in hepatic or other metabolic encephalopathies and may be periodic. Other conditions associated with periodic discharges include Creutzfeldt-Jakob's disease and subacute sclerosing panencephalopathies. Coma. Findings include lack of normal background, reactivity, or state changes in combination with continuous generalized polymorphic delta activity, FIRDA, low voltage patterns, periodic discharges that include PLEDs, or triphasic waves, or burst suppression pattern. In patients with coma following seizures, electrographic status epilepticus should be ruled out. Alpha coma with generalized, invariant, unreactive alpha frequency activity is associated with toxic or metabolic insults and cerebral anoxia and must be distinguished from normal alpha rhythms present in those with a locked-in state. Brain death. Confirmatory evidence includes the demonstration of electrocerebral silence, ECS, under proper technical conditions in the appropriate clinical context. Conditions associated with reversible ECS include overdose of CNS depressants, hypothermia, cardiovascular shock, metabolic and endocrine disorders, and very young age. And that is electroencephalography. Have a great day.